Good morning, friends. At the outset, I must thank Dr. Bansi Sabhu, Dr. Amit for making me part of this prestigious Diabetes India conference. The topic given to me is something new, but it's very important. Dr. Raka showed you certain curves, trends. I'm going to show you certain curves and trends which are there from the God. And we have just disturbed that thing. Circadian rhythm that I'm going to focus on. So if I ask somebody, what is your lifestyle? What do you mean by lifestyle? There can be so many answers. Fruits, vegetables, somebody will say it's vitamin D, some say take a nap, mindfulness, calcium, or some herbal medication, some vitamins, some detox. So there is no one answer. But one simple line lifestyle is what, when, and how much we eat, we sleep, and move on a daily basis. This is the simple, most important definition of lifestyle. And we have just changed it. We have just made it topsy-turvy. So this is circadian rhythm given by God, fundamental property of nearly all living organism goes by the sunlight. As day appears, your melatonin goes down. As there is a darkness, sun sets on, melatonin is increased. So every organ function is in synchrony with this circadian rhythm. Just to again focus on melatonin drops just around a 6 a.m. Just around 6 a.m. Your bowel movement starts working. Corticoids are on higher side. Alertness increases. Muscle performance peaks around your afternoon. Then again, as the sun sets down, melatonin rises, body cools down, and you find yourself in a deep sleep. But why we have shifted? Why we are in this era of shift worker? The term shift worker, when you are not doing the job between 7 a.m. to 6 p.m. And absolutely, we are all are shift worker. All are. There are three general shifts: evening shift between 6 p.m. to 10 p.m., night shift 11 p.m. to 3 a.m., early morning shift 4 a.m. to 8 a.m. Most of us are doing like this. And there are so many professions, and I don't think there is any profession left which is not doing shift worker because the need, critical services needs are there: police, doctors, utilities, transportation, production process, 8 hours or more. I was just asking to my taxi driver, and he says that, Doctor, I have not slept for last 3 days because you are having conference and I have to go to airport to pick some guests there. Then I have to travel. Then continuously daytime I am traveling. I have to take doctor to somewhere else. So I was thinking this is a great shift worker in front of me. So now what is important to understand? Few thousand blue light sensing neurons in each eye beyond rods and cones tune our brain clock to light. So there is a brain clock. So bright light stimulates melon spin. This is one hormone, which is the bright light hormone. It synchronizes brain clock, raises alertness, and reduces depression. Whereas orange glow from the fire candle light does not stimulate melanospin. And sleep hormone melatonin rises and supports sound sleep. This is the internal clock, suprachiasmatic nucleus and pineal body. If I ask somebody very spiritual question, Kota, Dr. Sunil is also sitting here. Where is Atma resides? कहाँ रहती है आत्मा? We have dissected human body multiple times. आत्मा कहाँ है? Any one answer? Quick. अरे यहाँ भ्रुकुटी के बीच में where we put the tilak. ऐसा क्यों है? There is, okay, chakra, from where it starts. There is, if you see a straight line from here, there is suprachiasmatic nucleus, and behind this is a pineal body. If there is straight penetration from this side to pineal body, everything is destroyed. You will not be able to look at the sun, you will not able to perceive the light, and the whole body goes off. So there resides the Atman. So suprachiasmatic nucleus, this is my hypothesis. Okay, so this is suprachiasmatic nucleus. Directly behind is pineal body, which secretes your melatonin. And then there is reactive, this is reticular activating system and hypothalamus part, suprachiasmatic part. So there is a sleep wake switch. Orexins are the hormones which are there for the awakeness. There is orexogenic hormones. There are monogenic hormones, monoamine hormones. These both lead to increased alertness. Whereas at the night time, there are GABAergic hormones and there is melatonin GABAergic hormones. So these are basically nighttime hormones, and there is a perfect balance. This balance leads to circadian rhythm in each and every organ. And endocrine and hormones, basically, there is harmonious release. Always, no organ, no endocrine organ will be giving you continuous supply of hormone. It is always in pulses to make the receptors activated. So this is beauty of endocrine. That's how endocrine is more spiritual science. So internally organs, they have certain cues. One cue is light. Another cues temperature, physical activity, and food intake. These are known as non-photic Witzibers, and they sets the clock of various organs. And this is how the clock is set up. Your muscles, liver, kidneys, intestine, cardiac tissues, all adipose tissue, pancreas, all respond to this circadian rhythm. Everything is in circularly. So you have a peripheral circadian rhythm, daylight cycle. You have internal. One is this is the pacemaker, which is sitting in suprachiasmatic nucleus, and then this further different organs, they have got internal clock system. What we have done, we are not living in a daylight. We are not living in a daylight because the daylight is roughly around 10,000 to 1 lakh luxes. We are in 100 or 200 luxes time. You see, the light for vision is not light for health. Every time, this is the daytime, we are sitting inside. Same will be our night. So everything remains in that type of scenario. This leads to dishormonogenesis. The hormones which are involved in metabolism at the daytime, like sympathetic tone, cortisol, adiponectin going low, and insulin, and also growth hormone decrease, melatonin decrease, all they will continuously anti-insulin hormone, they will continuously be upregulated during whole 24 hours. And this leads to impaired beta cell function, impaired insulin sensitivity, and impaired glucose tolerance. Ultimately, what you are finding, the day shift, which is routine work on your yellow side, this is the where the activity level is there, melatonin is low. Darker side, melatonin is going high, cortisol high on day side, lower on night side, but early morning peak is there. Core body temperature, oral mucosa, all they have got various rhythms. But once you shift to night time working or altered shift, then there is a flatness. So all these rhythmicities just gone off. And this leads to type 2 diabetes. Nothing to explain. It all leads to insulin resistance, dishormonogenesis, and leads to type 2 diabetes. You can start from anywhere. It will ultimately leads to type 2 diabetes. So what are the tips? How to manage? When you cannot change, I just asked my taxi driver, क्यों नहीं बदल सकते? He says, Doctor साहब, we have to survive. कैसे काम चलेगा? Similarly, we are doctors. We cannot change. So you have to accept, but you have to alter it. So tips on diabetes management for shift workers are important. Advised to eat lunch around 12 p.m. and dinner around 6 p.m. regardless of hours of the work. कम से कम समय का क्यू जरूर दीजिए. Avoiding eating large meals during night, eating during the day and early evening will help to balance blood sugar level. Eat healthy snacks during night shift to keep energy. This can be a tip, this can be a printout you can give to your patients also. They should not wait until they are too hungry to eat something. Pack healthy snacks with them, apples or whole grain, granola or something, raw vegetables or nuts. They can have these handy snacks with them. High protein snacks like sprouts, beans. These are important for them because at that time what they are getting from the vendor uh, is always high calorie snack, always carb loaded snacks. But they are getting at 2 a.m. in the morning. Choose low glycemic index carb food in comparison to high sugary snacks. Avoid fried and spicy food. These are very important things. Small trivial changes. Don't rely on snacks from the vending machine. Stay active. Try to maintain a regular workout. If possible, go for a walk during your shift or at least stretch out on your break. So this is important. Be sure to talk to your healthcare provider. Remain in continuous connection with your healthcare provider. Not only you are getting more insulin resistance and diabetes, but your diabetes will be also getting worse. There will be poorer control of diabetes. Glycemia will be very poorly controlled in those patients of shift worker. So follow the advice of your diabetes team. That is very important, and remain in contact with your healthcare physician. So concluding, night shift disrupts body natural circadian rhythm, leading to metabolic dysfunction and impaired glucose regulation. Chronic exposure to night shift affects pancreatic beta cell function, impairs glucose intolerance, disrupts lipid metabolism, contributing to development of type 2 diabetes. Reduced and fragmented sleep due to shift worker exacerbates insulin resistance and promotes weight gain, both of which are key factors in pathogenesis of type 2 diabetes. Effective management includes promoting lifestyle intervention like healthy diet, physical activity, sleep hygiene, alongside optimizing work schedule to reduce circadian misalignments, and remain away from that blue light that is your mobile. So try to shut down mobile, and detox is very, very important. Thank you. Thank you for the question.